Why is he rewriting the law to protect himself and the for-profit chains that are making millions in profit and not ensuring justice for families?
The Ontario government spent much of today defending a bill that would prevent COVID transmission-based lawsuits.
They're on the front lines, Mr. Speaker. Those people should not be put in jeopardy, nor should they gum up our system so that the bad actors can't get heard.
Only gross negligence in failing to adhere to public health measures to prevent the spread of COVID-19 would qualify a lawsuit.
And I said, hey, these families have the right to go after long-term care homes that were reckless and careless. And they have the right to do that. This does not protect them 100% by any means. I'm protecting the small convenience store when someone goes in there and accuses them of catching COVID in a convenience store, or all the restaurants, the 7,400 restaurants here and thousands across the province. Those are the people I'm protecting because they wouldn't be able to do business. And insurance rates are going up like I've never seen, and that's a warning shot for the insurance companies. You guys got to rein it in.
Those explanations did not mollify opposition members.
They're trying to give negligent long-term care homes a get-out-of-jail-free card, and I think it's wrong.
And it sounds like we know we're not prepared, right? So we're covering our risk. Well, we've had 1,900 people who died. We have double-digit cases in about 7 or 8 homes in Ontario, double-digit deaths. There's still a lot of risk out there. Families are worried, they're scared. Some families want justice, and we're pointing fingers at each other.
In Halton Region, there are currently 6 COVID outbreaks, all in so-called institutions, long-term care or retirement residences. Last week, the Premier said Halton Region was on the verge of being sent back to tight restrictions like the hotspots of Toronto, Ottawa, Peel, and York. This week, the medical officer of health says the situation has not changed.
When we see this level of community spread, we know that we are only a few to several weeks away from seeing a further increase in hospitalizations, in deaths. Certainly in the case of institutional outbreaks, we are going to see more of those possibly.
She says that's despite strict oversight and assistance by public health.
That happens when people come in and out of the homes, and they may think that they have very mild symptoms and are not even recognizing that they have symptoms of COVID. And unfortunately, it's when we let our guards down that we end up seeing it in the home.
The new law tabled by the Attorney General would be retroactive to the start of the pandemic. Anyone who has followed public health guidelines in good faith will be protected from lawsuits. Lisa Hepfner, CHCH News.